So, so happy to be here today and be given this platform to tell you a little bit more about the work here that goes on in New York City and a lot of the great collaborative processes that are in place using a One Health lens for our public health work. So just want to make sure you can see my screen and hear me before I get going. Okay, great, great, great. All right. So I have a lot. I could talk about our work for forever, so I did have to try to limit it. So I have a lot of slides, but let's start. I do want to kind of use this as a means for giving examples for the different work that we do with different animal and health and environmental health colleagues. Sorry, I just want to make sure I'm advancing. Did it advance? There we go.
Yeah, no.
Okay, okay. So yeah, so like I said, I do want to say like for the work that we do at the New York City Health Department, there's no public health without One Health. So we are going to use this time to go through the examples listed here on this slide as a way to highlight and demonstrate the work that we do and how it's so intricately and tied to the health of the environment and the health of animals. So just to make sure we're on the same page, the term One Health really is a good way of helping to define this concept or an approach where we're trying to optimize the health of humans, animals, and ecosystems by integrating these fields. As you're going to hear over and over, it really does require close collaboration and communication and coordination across these different sectors. The World Health Organization says this, and it's so true. This is really especially important as human activities that stress our ecosystems are creating new opportunities for diseases to emerge and to spread. So just to orient us to New York City, here we are on the east coast of the United States, surrounded by this red border. Drilling down, you can see lots of water around New York City. And while we often think of New York City as this urban jungle that's full of skyscrapers, we do have a number of green spaces that are peppered across the city. And these support a number of species of wildlife, along with pets, zoo animals, rodents, a variety of insects, and then, of course, over 8 million people that live here. And where I work at the New York City Health Department and like many other health departments, our focus is on human health. And our activities are very broad in scope, but my particular unit, we focus on vector-borne and zoonotic diseases and certain animal diseases that we've made reportable as well. And we are here to conduct surveillance to help monitor disease burden, arrange for specialized testing that might include rabies or maybe an avian influenza in people. We inform, educate, and empower healthcare providers and the public, and help to enforce public health laws like vaccinating dogs and cats for rabies. And again, as you'll see in the examples, we chose to share here, our work does require this close and collaborative partnerships, and we have colleagues in a variety of different environmental and animal health groups that are often government agencies, academia, and a number of nonprofits. All right, so let's dive into the variety of examples we're going to go through today. Okay, so this is going back, but we're going to start in 1999. We have this outbreak. We get a call from Dr. Debbie Asnish. She's an infectious disease doctor, calls the health department to report she has these a few older adults that are hospitalized with encephalitis. Encephalitis is an inflammation of the brain. And she thought it was probably due to some kind of viral infection. So, some red flags that there's a number of people with encephalitis, but what was really unusual was that they all had this kind of flaccid paralysis, kind of like a rag doll, where their arms and their legs were just very floppy. And that's not typically seen with most diseases that cause encephalitis. The other thing that was striking was that they all lived in the same area of northern Queens in New York City. So we called some nearby hospitals and we found there were several more patients with a very similar profile. And around the same time, we were hearing from veterinarians and park rangers and the public of reports of wild birds, mostly crows, that were dying. And then veterinary pathologists at the Bronx Zoo were finding encephalitis in some of their exhibit birds that had died. Testing of human and bird specimens ultimately identified West Nile virus as the culprit. It's a mosquito-borne virus I'm sure you've heard of that previously had never been seen before here in the Western Hemisphere. So talking a little bit about West Nile, this is a virus that's usually transmitted among birds by mosquitoes that feed primarily on birds. So you have this infected bird on which the mosquitoes feed. These mosquitoes pick up the virus, and then they're going to transmit it to more birds. And then more mosquitoes feed on these infected birds, and this all helps to amplify the amount of virus that's circulating in an area. And then we have other types of mosquitoes. Sometimes we call these bridge vectors or bridge mosquitoes that can feed on any type of bird or animal. So they may first feed on a bird that's infected with West Nile virus, pick up the virus, and then subsequently spread it to a person or a horse the next time they bite. And remarkably, this virus spread very rapidly across the United States. And after first appearing in New York City in 1999, it made its way all the way across the country and was detected on the West Coast in California by 2002. In response to this initial outbreak, New York City set up a mosquito surveillance and control program where we set traps to monitor the types of mosquitoes, their numbers, and then test them at our public health lab for the presence of West Nile virus. And wildlife officials will test birds and other animals. And you can see the map on the right-hand side. Kind of we update that weekly on our website to show where we've had detections in mosquitoes across New York City. So over time, since we started this program, we've been seeing that the proportion of mosquitoes testing positive for West Nile virus has been increasing. And while we're not necessarily seeing an increase in the number of human cases, what we have seen is more frequently the number of years where the case count exceeds 25. And we do expect that as the climate warms, we will have more mosquitoes, more virus, and more infections in people and birds. And West Nile virus, I think, is a good example of how working with animal health partners is really important to understanding complex disease transmission dynamics, and then also how the health of the environment can influence vector competence. All right, so now we're going to look at a disease that we see primarily in animals. The rabies virus has adapted really well to raccoons, and there's this raccoon-specific variant of rabies virus that we see in New York City and really all across the East Coast of the United States. And this raccoon variant is transmitted most often between raccoons, but occasionally we'll have what we call a spillover event where a rabid raccoon might transmit the virus to another animal, say a cat or maybe a skunk. And this raccoon variant first appeared in New York City in 1992, and this was due to the help of humans. There were hunters that arranged to trap raccoons down in Georgia, in the southern US, and then drive them and release them up in Virginia for hunting purposes. But what they didn't realize is that at least one of these raccoons was rabid, which then initiated this outbreak of rabies in the local raccoon population that ended up spreading northward. And since 1992, when that first introduction appeared, we detect raccoons with rabies regularly in New York City, along with a small number of other species. We will collect sick raccoons and then test them for rabies at our public health lab. And each year we'll see maybe between 3, sometimes up to 40 or so rabid raccoons that get reported across New York City. But then in 2010, we had this giant surge in the number of rabid raccoons with about almost 150 reported that year. And what had happened was there was this large outbreak of rabies among raccoons in Central Park, that really big park that's right in the middle of Manhattan in New York City. And the map on the right shows the locations of all those rabid raccoons. And it was really it's been the abundance of food in New York City and the lack of hunting that's allowed the raccoon population to explode here. And it's the density of the raccoons that facilitated this outbreak. On the left, you can see photos of the field work that we did that was done in collaboration with animal and environmental health partners, where we trapped and vaccinated hundreds of raccoons in the park. And this led to the elimination of the virus from Manhattan and a return back to our usual numbers. And it also offered this great opportunity for our animal health partners to collect blood and other specimens from the raccoons after we had trapped them and before they were released. And this helped them learn a lot more about the health of New York City raccoons. And following that outbreak, there was an oral rabies vaccine program that was put in place, and this is done in collaboration with wildlife and environmental health colleagues. And this is done to vaccinate raccoons across New York City every year to help limit transmission and prevent larger outbreaks like the one we saw in Central Park. These small baits that you see in the picture on the lower left are distributed by hand. Sometimes we use a helicopter, and then these bait stations that get filled with the baits. And again, it's all done to reduce the number of rabid raccoons and really protect other animals, including people and pets. And with rabies, I think, it's an example of how humans helped influence the emergence of this disease through translocation of these animals and then the adaptation of raccoons to this urban environment. And so it's really a collaborative One Health approach to rabies surveillance and control that helps us reduce the risk of rabies to all. Right, so New York City, we're famous for many things. We have Broadway, Central Park, Empire State Building, the Statue of Liberty, and of course our rats, these very highly intelligent, industrious creatures that I say are just trying to get by like the rest of us. However, in New York City and a lot of urban settings, rats are a known cause of a disease called leptospirosis. So in New York City, we conduct surveillance for this disease in both people and in pets. So rats are attracted to food refuse, where they can easily feast. And rats will shed this leptospirobacteria that causes leptospirosis in their urine. And so what can happen is that this urine can contaminate puddles or maybe moist soil that allow the bacteria to persist. And then people and dogs can get exposed and infected, maybe through contamination of open wounds or drinking contaminated water. And we've seen a striking increase in the number of human cases, especially in recent years in New York City. And when we look at who's getting leptospirosis in New York City, it's mostly um, folks who are male and middle-aged and typically exposed to rat urine at their place of work, where they may be handling trash or recyclables or maybe conducting rodent control, or maybe where they live if there's a severe rat infestation. As I mentioned, we also conduct surveillance for leptospirosis in animals, which is primarily dogs, and we investigate reports that we get from veterinarians, where are also seeing a slight increase in canine cases. There is a vaccine that's recommended for all dogs, but almost all of our canine cases are dogs that are not vaccinated, and sadly, almost a third of the dogs did die from the disease. And we get a lot more canine cases, and our canine surveillance has also been able to show us that these cases are occurring across New York City, suggesting that all people and dogs are at risk. When we identify a possible rat infestation during our human or our canine case investigations, we notify our rodent control program, and they will conduct an inspection and help coordinate any remediation that might be needed. We issue veterinary alerts to encourage owners to vaccinate their pets, and then we review infection control practices as well to limit transmission from dogs to humans. We've not seen any dog-to-person transmission, which is very reassuring. But we also recognize that the rodenticides that are used to control rats can kill raptors or birds of prey. So there's this concerted effort that's in place with our wildlife health colleagues to map any of the raptor nesting sites in New York City so as not to use some of these traditional rodenticides in those areas. And we have been wondering, why are we seeing this increase in cases? And so we've been working with Dr. Kramer's lab here in New York City to test rats and look at infection rates among rats for leptospirosis carriage across the city and over time. And we hope these results might help inform some of our understanding of the risk and then also help implement interventions to prevent infections in people and animals. And, this example, leptospirosis, again, showing how this highly urban environment offers rats, extensive access to refuse and how climate change, we think is leading to these shorter, warmer winters that is extending the breeding season for rats. And so we expect to see more rats over time. And so this One Health approach to surveillance helps let us know where people and dogs are getting infected and then also help to attempt with the collaboration of wildlife health officials to reduce the impact of the rodent control measures that are currently used on other species like raptors. Okay, so lots of news coverage these days for the past several years about avian influenza viruses. And just to kind of take a step back, there's lots of avian influenza viruses that are out there. And these are viruses that are primarily spread among water birds with occasional spillover to other species. And it's really important that we closely monitor avian influenza viruses in the bird populations because changes to an avian influenza virus that allow it to spread easily among people might be the thing that leads us to the next pandemic. So a highly pathogenic avian influenza A virus, the H5N1 clade, is the virus that's been circulating widely among birds with some spillover for the past several years and the one that's getting the most attention. But before we talk about H5N1, let's talk a little bit about an outbreak of a different avian influenza virus that occurred among cats in a New York City shelter. So this avian influenza H7N2 virus had been detected in poultry for years, first appearing in 1994 in poultry in the northeast of the US and then causing a few outbreaks in poultry since then. And then it kind of went away in the early 2000s, or so we thought, because in 2016, there was a sick cat in one of our New York City animal shelters that tested positive for this avian flu H7N2 virus, and it ended up spreading very rapidly across among the cats, ultimately infecting over 400 cats. And fortunately, most of these cats had very mild illness and they recovered without consequence. But what was concerning was that this was an avian influenza virus that we had only seen in poultry, and now it was the first time we were seeing this virus jump to a mammalian species. And what was even more concerning, that it was causing widespread transmission between the cats. So we worried, did this mean that this virus had changed so that it could easily be transmitted to people, and then even more concerning, between people? So what we quickly did was we had made arrangements to test hundreds of people, veterinarians, veterinary technicians, assistants, and other staff who worked with these cats to look for any evidence of folks who may have been infected. Unfortunately, you know, everybody was negative until the very end where we had one veterinarian who tested positive. This was a veterinarian who worked extensively with these sick cats and had collected swabs from sick cats without using a face mask. This veterinarian had very mild illness and recovered quickly. So we were able to quickly determine no concerns about a lurking pandemic here. But now, fast forward to where we are now and talking a little bit about avian influenza H5N1. So, this is still primarily a bird disease with some spillover, but, no sustained transmission among people, which is good. Um, there are these long-standing, multiple different animal surveillance systems that are in place and have been in place to monitor this virus in birds and animals. And that testing is done primarily by animal health and academic laboratories. In New York City, we fall within this major migratory bird flyway. And so we have birds flying through as they're migrating, and any infected birds can infect other birds here in New York City or animals either directly through contamination, through direct infection or contamination of the environment. I'm sorry. And we've had several birds since 2022, several wild birds that have tested positive for H5N1 here in New York City. We also have about 83 live bird markets in New York City where patrons can pick out a live poultry bird and have it slaughtered on site. And these birds sold at the markets come from farms in the surrounding areas outside of New York City. And the flocks are tested on these farms before they can leave the farm. And then there's additional testing done on the birds once they're in the markets. And we've had several detections in our live bird markets here in New York City, again, since 2022. We know cats can get very sick from H5N1, and there's been several cases in cats through consumption of raw milk, some raw pet food products, or contact with infected birds. And in New York City, we had 3 cats with H5N1 that were all associated with a raw pet food product that was made in California. As we mentioned, all the bird and animal testing is done by veterinary diagnostic labs and academic labs here in New York. And any positive results that are found in those labs are immediately shared here in with us in public health. And that allows us to investigate and follow up and identify any people who had contact with that infected bird or the animal. And then we work with those folks. They monitor themselves for any signs of illness. And if they become sick, then we make arrangements to have them tested and treated. And all that testing for H5N1 in people is done at our public health lab, sometimes at CDC, and to date, we have not had any human cases here in New York City or New York State. We are preparing for yet another season right now, but I think this is a really great example highlighting the importance of working with our animal health partners who are doing the monitoring of animal diseases that may affect humans or maybe even ultimately change to become more of a human disease. Okay, we're going to jump now to white-tailed deer. Surprisingly, we did have a growing white-tailed deer population in one area of New York City called Staten Island. Staten Island is an island. It's an actual island, and it's probably the least urban area of New York City. A lot of green space, a lot of backyards, and it was a place where deer became established. And once they became established, they did really well, and the population increased dramatically. And this was given the abundance of resources on Staten Island, a lot of green space, lack of natural predators, and again, no hunting in New York City. And deer are just gorgeous, beautiful creatures. But any overpopulation by any species can often be detrimental for a variety of reasons. And some people might say this is true of the human species, and I would not disagree. But with deer, there was also this corresponding rise in the number of deer ticks, which can spread diseases to people and to pets, an increase in the number of human cases of Lyme disease, and an increase in motor vehicle collisions. And there was also tremendous damage to the natural vegetation on Staten Island, which was leading to this loss in biodiversity as native plants were being overgrazed and forests just unable to thrive as all these saplings were being eaten. So there was a population control program that was initiated, and it was all done using this non-lethal sterilization of the male deer. And the metrics described on the previous slide were measured over time to assess the impact of this control program. And what we saw was reductions across the board. There was a 41% reduction in the deer population, a 94% reduction in fawn births, an 83% reduction in deer vehicle collisions, and an overall decline in ticks and Lyme disease cases. And then a slight reduction in vegetation browsed, which we hope will improve or restore some of these ecosystems and again enhance biodiversity in these areas. So the focus today has been really mostly on infectious diseases. So I did want to talk a little bit about some of the non-infectious diseases that we've done a little bit of work with. I think we all have experienced that extreme heat is increasing in severity and frequency due to human-induced climate change. And this can cause life-threatening heat-related illness in people and in pets. And in New York City, there's an estimated 525 people that die each year due to heat. And these are typically folks who don't have any air conditioning or whose air conditioning was not working. So, understanding that people do not want to leave their pets, New York City opened up these pet-friendly cooling centers with air conditioning so that people can bring their pets during these extreme heat emergencies. And folks can go online or make phone calls to find the nearest location where they can find relief for them and their pets. And I think there's a number of jurisdictions who have put measures like this in place to accommodate pets. And lastly, the New York City Health Department has done some tremendous work to reduce the number of smokers. And we recognize that smoking and vaping can also harm pets through secondhand smoke, or sometimes even ingestion of products and the toxins. We know that dogs and cats that live with smokers are at higher risk of certain types of cancers. Birds can also develop cancer and other health issues, and nicotine toxicity can occur within even just as little as 15 to 30 minutes of swallowing some kind of vaping cartridge. So we created these posters and these handouts as yet another tool to discourage smoking among pet owners. Again, people love their pets and are willing to do quite a bit to protect them. So these are given to veterinarians who are encouraged to post these in their clinics and also provide them as handouts to their clients. So that's the end of all the examples, and I hope that they did kind of offer a glimpse into how we rely on a One Health approach for the work that we do in public health, and to foster and ensure communication and collaboration across, the human, animal, and environmental health domains. There's this New York City One Health Animal Working Group that was started many years ago, sorry, and this group meets regularly. And when we meet, the idea is to review our respective roles, our responsibilities, and all the different resources that we have across all these major federal, state, and local organizations that handle animal-related issues in New York City. And we also are sure to share our contact information, even our personal cell phone numbers, so that, during an emergency or a crisis where it's, imperative that we're able to get a hold of one another outside of normal, working hours and whatnot, we have the ability to get in touch with each other. And with that, before I end things, I just want to acknowledge all the incredible work that's done by our partners in the animal and environmental health community. I was able to kind of give our perspective and how it benefits us in human health, but there's so much great work that goes on by our partners to advocate and protect the health of animals and the environment here in New York City. So kudos to all them and that great work and their dedication and willingness to collaborate with us here at the New York City Health Department. It really does make our work that much more meaningful and productive. And I will end it there. Thank you so much.